Twin-to-twin transfusion syndrome, or TTTS that we often refer to it, is a disease that is specific to a set of twins that share a placenta. And when they share a placenta, instead of only having each baby interact with the placenta, then to the mom and back, you actually start to have some interactions between the babies. Essentially what happens is that you have an overshare of volume or nourishment from one baby to the other. So you end up with one baby that's called the donor baby, because that baby is unfortunately shunting or oversharing blood and volume with the other baby that we call the recipient. The recipient essentially ends up with too much volume and too much nourishment. Just like any of us, if you have too much fluid in your blood system, your heart can struggle to keep up. You kind of overload the heart is how we think of it. We use the initial staging, which pretty much everybody uses, called the Quintero staging system. We use a modification at our center here that looks at the heart function for both babies, but we're really importantly looking at the heart function of the recipient. Heart dysfunction is not necessarily relegated to just the higher Quintero stages. So that's an important adjunct that we use in order to try to figure out which is the sickest pregnancies, which would most potentially benefit from having a procedure or a treatment.